The kids are back in school, and of course that means so are germs.
Yeah, doctors typically see an increase in illnesses this time of year, but of course the last 2 years have really been anything but typical. Our Dr. Frank McGeorge is here with a special look at the illnesses your children are most likely to catch in the weeks to come.
That's exactly right, Karen and Jason. You know, our weekly What's Going Around report usually focuses on the illnesses that are already making people sick. But each September, we ask local pediatricians to predict the issues that they're expecting to see. You can kind of think of it as an illness forecast for the new school year. Well, this year we asked one of them to break down the trends and offer his advice to help parents weather that storm.
Virtual learning, masks, and social distancing have kept many of the typical childhood illnesses at bay these past 2 school years, but no more.
As we move back to something that looks like normal, you know, part of normal is getting some of these respiratory viruses back. And so
Dr. Scott Grant is a pediatrician at Children's Hospital of Michigan. He's also a father of 3, bracing for the weeks ahead.
As kids get back to school, they're going to be hanging out with one another and passing those germs around, and so we expect to see a big uptick.
Grant says expect viral illnesses in general to top the list.
Runny noses and cough and congestion. Some of these kids might also have some low-grade fevers. Those are probably the most common things.
He's also seen an increase in pink eye lately. Most experts predict cases of COVID will increase this fall and winter. Grant says that will add an extra layer of confusion for parents.
Unfortunately, the symptoms of COVID are very similar to the other symptoms of all the other respiratory viruses that we expect to see, so it's going to be really hard for parents at home who has a kiddo who's got a runny nose and a cough to know, is that COVID, is that just a cold, is that flu?
Grant does expect flu to be much more of a factor this year.
We've had a couple of very strange flu seasons over the last 2 years that have been sort of interrupted because of COVID and other things that have been happening in our community, and so it's likely that flu is going to make a comeback at some point, and so I expect that that will be one of the things that we're treating.
Grant says he also typically sees cases of RSV pick up in the fall. It's also prime time for fall allergies.
Certainly, as allergies get worse, asthma tends to go along with that for a lot of kids, and so this is a time of year where we also expect to see a lot of asthma exacerbations, flare-ups of kids who have asthma.
To protect against the most serious illnesses, Grant has this advice.
We wish we could protect kids against all these infections, but there are 2 in particular that we do have specific things that we can do to protect them against, and so that's vaccination. So we have vaccines both for influenza and for COVID-19, so strongly recommend that if there's not any contraindications for your family, to get everyone in your family as protected against those viruses as possible.
Frequent hand washing, covering your coughs and sneezes, and keeping kids home when they're sick are also important, along with testing to rule out COVID or flu. But some illnesses are inevitable.
I would expect that parents should anticipate they're going to see more of these types of infections, and it can be really frustrating for parents, but it's certainly something to prepare yourself for.
The bottom line, this could be a bumpy year.
If you can sort of give yourself a little grace, take a deep breath, like it's going to be, you know, it's going to be okay. Somebody's going to bring a germ, it's going to go around the class, your kids are going to get sick.
Now, we actually asked several local pediatricians to share their predictions for what's going to be around in the next school year, and you can read all of their responses on the health page at clickondetroit.com. Now, many of them also asked us to urge parents to make sure that your kids are caught up on other childhood vaccinations, chickenpox, Hep A, whooping cough, polio, and so on, because many children have frankly fallen behind. That's putting them now at increased risk for illnesses that we don't typically see.
There's so much to think about.
Yeah.
I worry. I think I worry too much. So is there like a level, like, okay, don't worry about this, but you should really worry about this?
Yeah, you know, I think certainly if a child is becoming short of breath, that's something that you might want to bring them in for and get care right away for. Dehydration, a high fever. Basically, you know your child best, so anything that just doesn't feel right should definitely trigger a call to your child's pediatrician. And they expect a surge in illnesses this time of year, and so it's always going to be better to call just to make sure that you're doing everything that you really should be doing.
Not what's going around, what's going to be going around.
Right, but it's inevitable.
Yeah.
Something will go wrong.
Can you predict injuries to the Lions this year? Can you do that?